Hi, I'm Vinayak Kumar. I'm one of the Chief Cardiology Fellows at Mayo Clinic, and I'm here joined by Dr. Fanaroff from the University of Pennsylvania. Dr. Fanaroff, can you please tell us about your trial?
Yeah, so we did the Be Active trial, which is a randomized controlled trial of different approaches to increase physical activity in patients with or at risk for atherosclerotic vascular disease. And specifically, the trial was testing gamification, financial incentives, and the combination of gamification and financial incentives versus control to see which one increased physical activity the most.
Outstanding. And what have you found?
Yeah, so when you look at the trial, you see that physical activity increased by a lot actually in the control arm. So from baseline to the end of the intervention period, which was 12 months, physical activity increased by 1,400 steps in the control arm. But the intervention arms, so the gamification and the financial incentive arms, mean daily steps per day increased by 500 steps per day more than the control arm. So these people were increasing steps per day by about 1,900 steps per day by the end of the intervention period. And the combination increased mean daily steps by about 850 steps per day compared with more than the control arm. So they had increased their steps by about 2,300 steps per day compared with the control.
That's incredible. It seems to be fairly effective then.
Yeah, so these are effective interventions. They increase steps by a meaningful amount. I think that one thing that's interesting is that even the control arm increased steps by a lot. And I think that we can talk about this a little bit later, but I think that the control arm increased steps by a lot, and the interventions that sort of relied on behavioral economic theory increased steps by even more substantially over that.
So how much did this end up costing, or what kind of interventions were specifically used to help get these people more active?
So the way that the trial was designed is that we identified people that met our trial inclusion criteria using EHR algorithms. So these were people that had an ASCVD risk of greater than 7.5% by the pooled cohort equation, or people with established ASCVD. We contacted them by email or text message with a link to our study website on what we call the Way to Health platform. And on that platform, they were able to provide informed consent and register for the study and complete baseline questionnaires. We then sent them a Fitbit device, which they wore for 2 weeks to establish a baseline step count. And we took that baseline step count and we asked them to increase their daily steps by about 33 to 50%. And then once they did that, we randomized them to one of the four arms. So the gamification arm, we enrolled them in I'll back up. The control arm, that was really all they got. So they set a goal to increase steps, and they got a text message every day saying, yesterday you took however many steps they took. And that was the intervention. And they knew that we were sort of monitoring their steps, but they weren't really getting any intervention beyond that. The gamification arm, they were enrolled in a game where they got 70 points each week, and they lost 10 points each day that they didn't meet their step goal. And at the end of the week, if they had more than 40 points, they moved up a level. If they had less than 40 points, they moved down a level. And they got text messages every day telling them whether they met their goal, how many points they had left, and whether they were going to move up or down a level. And then at the end of the week, they got a text message telling them they moved up or down a level. And when they also identified a support partner that got a message every week telling them how well the participant did in the study. The financial incentives arm, we put $14 into a virtual account for them every week, and they lost $2 every day they didn't meet their step goal. And again, they got text messages every day telling them, you either met your step goal or didn't, you lost $2, and here's how many dollars you have left for the week. And then the combination arm got both of these. So those are the interventions. They were all sort of delivered in an automated fashion using the Way to Health platform, which really, I think, facilitates scalability as you think about this in the future.
Outstanding. Where do you think this trial is going to go next?
So I think that, we know that physical activity is associated with improved clinical outcomes. And we know now that interventions like the ones we have in this study, these scalable, easy to deliver interventions can durably increase physical activity over a 12-month intervention and then 6-month follow-up period. I think the outstanding question is, if you increase physical activity in this way, do you improve clinical outcomes? And I think the study that I want to do more than anything going forward is really, this study, but much larger, to see if we do increase physical activity, can we reduce cardiovascular outcomes, and outcomes that are important to patients.
And just as another question, was this pretty scalable across different demographics of folks, or were there specific demographics that were heavily represented in your trial?
Yeah, so the demographics in our trial match the demographics at the University of Pennsylvania health system. The mean age of the patients that were enrolled was 67. 25% of the patients were Black. They took about 5,000 steps per day at baseline, which is about the average for Americans. I think that this does match what we know is our sort of patients that we see in clinical care. Now, like any trial, there's some selection. We ultimately, about 1% of the patients that we emailed wound up enrolling in the trial. So I think you have to ask, does this generalize? But I think that's a question you have to ask with any randomized controlled trial.
Outstanding. Well, thank you so much for joining us today. For more videos like this, please check out our YouTube channel at Fits on the Go and follow us on X at Fits on the Go. Thank you.